Welcome to today's HealthLine webinar from the American Association of Kidney Patients titled Understanding CKM Syndrome, Connecting Heart, Kidney, and Metabolic Health. Thank you for joining us today. My name is Jerome Bailey, Director of Patient Engagement and Advocacy for AAKP. AAKP thanks AstraZeneca for the sponsorship of this educational webinar. AAKP is the oldest and largest fully independent patient-led kidney patient organization in the U.S. We are proud to host this webinar series as part of our mission to empower fellow kidney patients, family members and care partners, healthcare professionals, researchers, and policymakers. AAKP's HealthLine and HealthLine Innovative webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of an individual's treatment, and to that end, AAKP is a champion for full patient care choice, the protection of the patient-doctor relationship, and the elimination of artificial barriers and government determinants of health that impede patient choice and access to available treatment options. At AAKP, we work to ensure that patients have a central role in the research and development process so that unmet needs are identified and unique patient insights and lived experiences fully inform innovation and the product development lifecycle. This includes clinical trials to regulatory action and payment decisions. Through our initiatives, we aim to ensure patients have a central voice in research and innovation. By leveraging lived experiences and unique insights from the kidney community, we help drive meaningful advancements across the entire product development lifecycle, from clinical trials and regulatory processes to payment decisions. As medical science progresses with personalized medicine, cutting-edge technologies, and novel treatments, through this decade of the kidney, the potential for better outcomes in kidney care, as well as multi-organ and metabolic care, has never been greater. We are excited to present today's program, which highlights how heart disease, kidney disease, and metabolic issues, including diabetes and obesity, are closely connected, yet are often treated as separate conditions. Leading up to today's webinar, AAKP conducted an independent flash survey through our Center for Patient Research and Education to learn how kidney patients are managing care coordination in regards to kidney, heart, diabetes, and obesity. We are delighted to share some of the results with you that will help set the stage for our speakers. To walk us through what we learned, I'd like to introduce AAKP's Vice President and Chair of Policy and Global Affairs, Paul Conway. Paul is a passionate advocate for patient-centered care, patient participation in true shared decision-making, and the use of patient insights in kidney research. As a kidney disease patient himself for 49 years and a 29-year transplant recipient, he has been recognized for his advocacy work with several national awards, including the President's Medal from the American Society of Nephrology and the Presidential Volunteer Service Award for Lifetime Achievement. Paul has served in 4 U.S. presidential administrations, including as Chief of Staff for the U.S. Department of Labor. He was selected by the FDA to serve as the inaugural chair of the FDA's Patient Engagement Advisory Committee and has served on the American Board of Internal Medicine Nephrology Specialty Board, as well as multiple CMS technical panels related to dialysis quality improvement measures. Please join me in welcoming Paul.
Thank you very much, Jerome, and thanks for putting together this webinar on an exciting topic. It's a topic that folks are starting to hear a lot about, CKM syndrome, cardiometabolic syndrome. And for kidney patients, I think in particular, these are 3 different words that have been put together, but it's actually representative of our lives and many of the journeys that we have gone through together. What we did is we did this survey because we wanted to gauge what the understanding was among patients of CKM syndrome. But just as importantly, and I think patients will find this quite fascinating, what is the level of understanding among medical professionals right now of CKM syndrome? Because we're really at the beginning of looking at multi-organ solutions for kidney patients instead of the siloed status quo approach of take this organ and part of you to this specialist and take that organ to another specialist. As a patient, we don't think like that. We think about fixing the whole person. And that's really where we're headed on this with new medical innovations and new medical practice. It's a very optimistic time to be a kidney patient, and this is why we call this the decade of the kidney. So let's get right into the data that we have here. We went ahead and rolled this survey out this month. Jerome and our team, Aaron Cayley, managed this quite well. Let's go ahead and take a look at the first slide. For respondents, we were trying to get a feeling for the types of health conditions that they have. And you can see here, kidney disease, 97%, diabetes, 43%, obesity, 31%, heart disease or heart failure, 29%, none of the above, 1%. So it's pretty representative of what you might see in a clinic or what you might hear from your kidney pals. We asked, choose all that apply. Do you know your numbers for your lab tests? Blood pressure, 97%. People are pretty familiar with that. Blood glucose level, 84%. LDL cholesterol, 75%. And UACR, the urine albumin creatinine ratio, is 61%. And I think this is also very representative of kidney patients. We're driven and known by our numbers. We asked folks what the biggest challenge was for them or for their loved one in managing multiple health conditions. And this is where it gets pretty interesting. About a third said managing lifestyle changes. That can be diet, exercise, and weight. Understanding how conditions affect each other, 28%. Scheduling and meeting with multiple specialists, 20%. Cost of treatment and medications is 13%. Keeping track of medications is 2%. And something else was attributed to 5%. But if you take a look at the biggest driver here, it's really managing lifestyle changes and understanding how conditions interact with other conditions. We asked how folks feel about, or if they're taking care of a loved one, healthcare providers in terms of how they communicate together and work together to coordinate care across kidney, heart, and primary care. About 36% said they work very well together. 36% said somewhat well. Rarely, 13%, and not at all, 10%. From our standpoint, there's a lot of work to be done among professionals in the somewhat category, and we really have to pay attention closely to professionals that rarely or not at all, from the patient perspective, are working together, because it's almost 25% of your patients. That's where we see an opportunity for education. We asked folks, how confident do you or your loved one feel about managing their own heart, kidney, and metabolic health together? 26% said very confident. 49% said somewhat confident. Not very confident, 22%. Not at all, 3%. So this is kind of a mixed picture here. But of those who are very confident, we know that there are patients that are described as highly motivated and engaged, and I'd say that's what that 26%. But again, somewhat confident and not very confident in these categories. This is where we have more work to do in terms of coordination of care. We asked if a healthcare provider has ever discussed how kidney health, heart health, and metabolic health, such as diabetes or obesity, are connected. And in this one, 35% said yes, 52% said no, 13% were unsure. This slide, I think, is quite powerful because it's what many patients feel is they go from specialist to specialist and it's not coordinated. The patient becomes the center of the wheel in trying to drive the coordination, the communications, and the explanations, because it's not coming directly from the providers themselves. We asked if a transplant professional has ever discussed how kidney health, heart health, and metabolic health, again, including diabetes or obesity, can impact transplant readiness or eligibility for a transplant. Are you healthy enough that if you get the call, you're ready to go? Only 24% said yes. 67% said no. Again, this is a key issue here, because how your kidney, your heart, and your metabolism is working drives your numbers and drives your readiness and strength to receive a transplant. And if you've been waiting for years on a transplant list, you must know how your kidney, your heart, and your metabolism is working together. You owe that to yourself. Just as importantly, the medical professionals owe it to you to explain how those interact and how they can impact your readiness for a transplant. We asked if folks in general are familiar with the term Cardio-Kidney-Metabolic Syndrome, or CKM Syndrome. About 28% said yes, 60% said no, 12% were unsure. We're not surprised at this. This is the beginning of a new era of medicine and a new way of thinking among medical professionals in terms of how they treat the whole person, CKM syndrome. We were pleased that almost a third of our patient respondents and healthcare respondents were familiar with it. But again, at the beginning here of this CKM Syndrome education campaign, we want to target those who are not familiar with it. We asked if a medical team recommended new, safe, FDA-approved medications that could help you better manage or address heart, kidney, and metabolic issues. Would you be interested in trying them? Again, these would be for drugs that came through FDA as safe and approved. 81% said yes. 1% said no, not sure, need more information, about 20%. What this slide tells us is that patients are attuned to the fact that they know that they themselves as a human being, everything kind of interacts, and that if there is a therapy that addresses more than one chronic problem, they would be interested in it. We asked if a medical team recommended new, safe, FDA-approved medical devices that people could wear to monitor their heart, their kidney, or metabolic health. Would people be interested in trying them? 75% said yes, 3% said no, and again, a little more than 20% said they'd need more information or they weren't sure. This is a tribute to FDA, that FDA is greenlighting and trying to speed safe new products into the marketplace that empower patients to monitor and take command of their numbers so that they can strive for better kidney, heart, and metabolic health. We asked folks if they thought medical students should receive more education about how heart, kidney, and metabolic syndromes and conditions are connected and how they directly impact patients. 92% said yes, 8% said they weren't sure. We asked this question because our president, Ed Hickey, at AAKP, serves on the American Board of Internal Medicine. I had the honor to serve for 6 years prior to Ed, and we raise a patient voice on issues of medical student education and later the credentialing and certification of medical professionals in the kidney profession. And this question was intuitive to us, and we think it is definitely obvious to others that if a medical professional is treating you as the patient, you want to make certain that their education reflects the latest thinking. And you can see here that patients think that CKM syndrome should be a source of focus for new medical students. We asked if folks agreed that heart, kidney, and metabolic experts should receive more education and cross-training on how these conditions interact and impact patients as a requirement for medical board certification and recertification. So a doctor would have to demonstrate practical knowledge and competence in coordinating your kidney, heart, and metabolic issues. 89% said yes. 11% said they weren't sure. They probably need some more information. But overwhelmingly, patients said, yeah, if somebody's going to be taking a look at me for heart conditions, kidney conditions, and metabolism issues, then they should absolutely have both the education and the certification. We agree. So this is where it got interesting for us as patients. We decided to pose questions to medical professionals, and we asked how familiar they were with Cardiovascular-Kidney-Metabolic syndrome, or CKM syndrome. 14% said they were very familiar. 43% said they were somewhat familiar. 33% said they were aware of it, but they weren't familiar with the details. And not familiar at all, 10%. So if we go from the bottom up here, 43% of the medical professionals across these disciplines who aren't seeing this as an interconnected syndrome at this point. That means that they need education and they need patient insights on what the burdens are of these syndromes and these conditions, especially when you're a patient managing all of them. We asked healthcare professionals how confident they were in managing patients with overlapping heart, kidney, and metabolic conditions. 15% said very confident, 40% said somewhat confident, 30% were neutral on it, 5% were not that confident, and not confident at all, 10%. I guess we know which doctors we're not going to go to. They're at the bottom of the chart. But again, on this, it shows the level of education that's needed among healthcare professionals in order to instill confidence in their ability to treat you as a kidney patient who may be managing multiple chronic conditions. We asked healthcare professionals, how often do you discuss the impact of cardiovascular and metabolic health on kidney transplant readiness with eligible patients? This was more inspiring. 47% said routinely, 16% said occasionally, 11% said rarely. No one said never, but 26% said not applicable to my practice. That concerns us because we actually think that number is probably not realistic, that some professionals just may not be aware or familiar with the criteria for transplant listing and transplant readiness. But overall, again, another opportunity to educate the healthcare professionals who take care of us. We asked healthcare professionals what's the greatest challenge to implementing coordinated CKM care into their practice. 21% said limited patient awareness and engagement. 21% said coordination among specialists. So it's not just patients that have a hard time getting a hold of other specialists, it's others, doctors and fellow professionals. 21% said limited time during patient visits. Yeah, 5% then spread out across a couple of different factors here, including insurance and access to medication or reimbursement issues. And then another 16% attributed to other reasons. But the focus here, really, in terms of the greatest challenge, we think, is the coordination among specialists in the limited amount of time that your doctor may have with you in a visit to actually get into these issues. We asked the professionals how they viewed their own profession and whether they thought that medical students should receive more education on how heart and kidney and metabolism were all connected. 100% of them said, we agree. We do need more education for medical students on the connectivity of these issues. And for the respondents who are medical professionals, we asked, do you think heart, kidney, and metabolic experts should receive more education and cross-training on how the conditions interact and impact patients as a requirement for medical board certification and recertification? Again, we were very pleased about this. It reflects the level of awareness and professionalism and curiosity about innovation. 84% said yes. It should be a matter of board certification and recertification for medical professionals. We asked if folks felt confident that the federal government, including the Centers for Medicare and Medicaid Assistance, or what we call CMS, is keeping pace with research and innovations in the field of CKM, and how those changes may require changes in reimbursement policy. So only 17% thought the federal government was keeping pace with the innovations and the changes in CKM syndrome. 39% said no, and 44% said they weren't sure. We focused on that 44% because if you're a medical professional and you're at the doorstep of a brand new way of thinking about caring for patients, and you're just not certain of how CMS is going to approach this, well, that would be a big red flag for you because you're not going to understand how reimbursement issues will work. The second number here that's concerning to us is 39% did not have confidence in the federal government or CMS to keep track with the innovations that are happening in CKM syndrome, and that is a big concern to us. So there you have it. There's some of the data that impacts this whole discussion about CKM syndrome. And towards the end here, we took a look at what medical professionals themselves said about their profession and their fellow professionals. At AAKP, we know this is the decade of the kidney. We've borne witness to fantastic and miraculous changes in kidney medicine and new innovations in drugs, devices, and diagnostics. We're extremely happy about it. We're extremely happy that folks like AstraZeneca and others are in this space and talking about how hearts and kidneys and metabolism are all connected. Because we know this as patients, it's the whole person that needs to be treated. And when we have multiple conditions, we need a whole person approach to solving problems. And that's exactly what this is about. There's a great opportunity here. But if we don't get the alignment in terms of education for medical professionals, and most importantly, if we don't encourage our federal government to start thinking about things post status quo kidney care and how it's being transcended by innovation, and that they should reflect that in regulatory and payment decisions, then that's tough ground that we have to fight on. And we have to fight to increase the federal government's pace with innovation so that we as patients can have safe new products in the marketplace to choose from and be empowered to take care of our own care with the doctors we trust. Thank you very much for letting us lay out the information from this poll. And again, over to you, Jerome. Thank you so much for putting on this absolutely fantastic webinar and having our guests here and the hard work that went into the survey data. And for all the survey respondents, thank you very much.
Paul, thank you very much. We really appreciate you bringing us the survey results and just for being with us. Thank you. So those survey findings provide an excellent foundation for today's discussion and reinforce why conversations like this are so important. Now let's turn our attention to today's speakers. Our first speaker is Dr. Alex Flannery. Dr. Flannery is the U.S. Medical Director for Chronic Kidney Disease at AstraZeneca. A pharmacist and researcher by training, he has more than 13 years of experience in direct patient care and leading clinical research and quality improvement initiatives in the nephrology field. He is also a fellow at the American Society of Nephrology. AAKP considers Dr. Flannery a true patient advocate and an ally in our efforts to advance true patient-centered care. Today, Dr. Flannery will help us better understand CKM syndrome, why the heart, kidneys, and metabolic health are so closely connected, and what patients can do to protect their long-term health. Dr. Flannery, welcome, and thank you for being with us today.
Well, thank you, Jerome. Very much appreciate the invitation and thrilled to be here today. I'd like to thank AAKP for the chance to come and talk about CKM, and also for everybody listening and watching today, taking time out of your busy day so that we can dive into it. And it is a relatively new recognition and sort of alignment around connecting heart, kidney, and metabolic health. And so that's what we'll go to today. I thought the intro questions was just a phenomenal intro to this topic to shed light. You can almost see the evolution in real time, I feel like, with those questions. So let's dive in just to start on a level set. What is CKM, or Cardio-Kidney-Metabolic Syndrome? It's a health disorder due to connections among heart disease, kidney disease, diabetes, and obesity, leading to poor health outcomes. And I think it's important to say up front what CKM is not. So it's not a brand new disease that was just invented or discovered in the last 1 to 2 years. Rather, it represents a growing recognition of the complexity and the interplay between these diseases, like with the heart and the kidney and diabetes, that are very commonly overlapping. And we'll dive into a little bit of that overlap today and just what that means. So this was hinted at a little bit in the intro, but just to put some medical societies with it, there is a formal recognition of CKM now. So it looked like many viewers on the call had really heard this term before, but this isn't just a single medical organization proposing CKM. You can see here many organizations, both within the kidney space and the cardiology space, that you've probably heard of, actually have formal recognition of CKM. And we'll talk a little bit about patient materials that are targeted more toward healthcare professionals. But this is especially as of 2026, this is a formalized syndrome that I think more and more in healthcare are talking about. So let's spend a little bit of time just understanding what drives the connections. So this diagram has the heart at the top, has the kidneys on the bottom right, and then on the bottom left, we're going to call this metabolic. So we're going to call this diabetes, we're going to call this overweight or obesity, and sort of what drives the connections when we say that this is a complex interplay among this. And so I think we've known about the relationship between the heart and the kidney for some time. So your kidney receives about a quarter of the blood that the heart pumps out. So if your heart is not pumping as well, it makes logical sense that your kidney would get less blood flow and suffer from some of the effects of that. Vice versa, if you have kidney disease, your kidneys can cause you to accumulate fluid. When you accumulate fluid, your heart has to work harder to pump that extra fluid out. So hopefully you can see how there's that directional relationship between the two. I think the thing that CKM syndrome is really starting to bring into this equation as well is the concept of obesity. And so in terms of, how is obesity a risk factor for these different diseases? One can be space. If there's really less space for an organ in the body, physical compression can be harmful. The second, and the one that we're learning more and more about, is that there's actually different types of fat tissue that can accumulate near these organs. And depending on the type of fat tissue they can actually drive inflammation that drives disease. And so hopefully that's a glimpse, at least, of how complex this relationship is, but importantly about how they affect each other in the diagram. So by the numbers, just as an introduction, and some of these are numbers from, again, a formal recognition that I'll talk about throughout this presentation today. CKM syndrome has been recognized and now has a formal guideline by several different nephrology and cardiology organizations. But within this framework, at least 3 out of 4 US adults may have reversible CKM syndrome. 50% of people with stage 4 or 5 CKD have cardiovascular disease. So cardiovascular disease is very, very common in people with CKD. And actually, almost 50% of deaths in CKD come from cardiovascular disease, not necessarily from kidney disease. And then in terms of risk factors for developing CKD, both diabetes and high blood pressure are the leading causes of CKD. So when we talk about that interplay, those are very, very important risk factors, not only way upstream before developing CKD, but even once you have CKD. And we'll talk about that some more. I want to briefly highlight stages of CKM syndrome. And I don't want to leave you with the misimpression that you're going to go to your next doctor's visit and someone is going to tell you that you have stage 2 or stage 3. But just to kind of walk through this and provide an illustration of the progression and the risk level of some of these different diseases in CKM. So if we think about the 1 in 4 patients across the country that don't have any disease state or any diseases and are not at risk, that's stage 0 CKM. Stage 1 really is driven by this overweight and obesity and some of that dysfunctional adipose tissue that we discussed. So that's really at risk. Stage 2 is once you develop something like mild to moderate CKD, or some of the metabolic risk factors. And so when we talk about these, we mean like hypertension or type 2 diabetes. So I call this out because CKD here is a risk factor, the same level that hypertension or diabetes is. Stage 3 is what we call subclinical cardiovascular disease. So what do we mean by that? That's basically cardiovascular disease before you can see or feel it. So you may have plaque buildup without any type of symptoms that can only be detected by imaging, for example. That's a type of subclinical cardiovascular disease. The thing that I want to point out here is that in this guideline that just came out a few months ago, very high risk chronic kidney disease is actually considered a risk equivalent of this subclinical cardiovascular disease. And so you can see the risk that CKD is here in stage 2 and 3 of CKM. And then stage 4 is really a more overt clinical cardiovascular disease, things that you're probably more familiar with: coronary heart disease, heart failure, or stroke. So again, just to go through the progression and the risk factors of some of these disease states along the spectrum of CKM syndrome. So I want to talk just a little bit to make this more practical, just use a couple of examples, because CKM syndrome, it is exciting. It's also very, very complex. So to put some really concrete information and facts, let's talk a little bit about the urine protein. And it looked like this was a question from the intro slides. I'm sure many of you have been tested for protein in your urine. If you've had conversations with your kidney doctors about how foamy your urine might be, you probably have either a urine protein to creatinine ratio, or the more common one, a urine albumin to creatinine ratio, which essentially measures the amount of protein that's spilling into your urine. And this is an important test, not only in diagnosing kidney disease, but also following the progression and really your risk of further kidney disease in patients diagnosed with CKD. So testing frequency is ideally at least once a year, depending on the stage of your CKD, at least once a year to monitor for your risk of kidney disease progression. The higher your UACR, the more likely you may be to progress in your CKD, even toward dialysis. The interesting point that I want to point out about UACR is just as much as it is a risk factor for kidney disease, it's also a risk factor for cardiovascular disease. So the fact that a lab measured from your urine can really tell you about your cardiovascular risk, I think is a very tangible evidence of just how connected your heart and your kidneys are in this CKM syndrome. And one of the things that I think hopefully you will see in the next couple of years is really an increased use of risk scores to tell you about your cardiovascular risk. One of these is called the PREVENT score, and actually using your UACR level, in addition to things like your age, some of your other lab values, what diseases you have, can actually help you quantify your cardiovascular risk. But this is the story, if you will, of how a marker in UACR that has traditionally been thought of, I think, among both patients and healthcare providers as a kidney marker is actually both a very strong kidney marker and a cardiovascular risk marker. The other really very tangible example, I think, to talk about is high blood pressure and its relationship to CKM. So focusing on this graph on the bottom, we talked a little bit already about how high blood pressure is actually a risk factor for developing chronic kidney disease. Your kidney has very, very small blood vessels. Increases in pressure in those blood vessels can be harmful to your kidney. And then going back to the left, we also talked about how chronic kidney disease can cause you to accumulate fluid, it cause some other hormonal changes that actually just reinforces more high blood pressure. And so again, you start to see this cycle here that we talked about on one of the earlier slides, and you can see how your cardiovascular risk really compounds. And so I think the highlight that I would focus on here is high blood pressure is not only a risk factor for chronic kidney disease, but if you have chronic kidney disease, high blood pressure continues to be a risk factor for kidney disease progression as well as cardiovascular disease risk. Approximately 1 in 5 adults with high blood pressure may have CKD, and of all adults with high blood pressure, only approximately 1 in 4 are controlled at their goal levels. And so it's not uncommon, particularly in the setting of CKD, to be on multiple different blood pressure medicines to reach your blood pressure target. And there haven't really been new blood pressure medicines for a while. And lately, there have been several new medications with actually new mechanisms targeting blood pressure, particularly if you're requiring multiple different blood pressure medicines to control. So we talked a little bit in the intro about why a more coordinated approach is needed. And I think it really comes down to the science and how complex it's gotten, and really maximizing the way that healthcare providers work together to provide the best care for patients. So I think the last decade in the explosion of treatments for kidney disease has been such a welcome approach. And I love the comment about CKM really, being an advance for the next decade. But I think medication choices, while that complexity is good, the choices and the process for getting to those medications has required a much more holistic approach than ever before. So if you're in a clinic, for example, I'm no longer following a checklist of which medicines you may need to be on. There's a lot more things that we're considering these days, depending on maybe what your biggest problem is at that particular moment and how we prioritize the addition of certain medications and how we prioritize the benefits and risks for the different disease states that maybe are present. Again, remember, CKM can be as simple as one disease potentially to as many as you saw on some of those slides there that overlap and have different complementary treatment approaches. So in terms of treatment, we'll talk just a slide or two about really some of the lifestyle modifications, and then just to highlight some of the pharmacologic or medications that have really been shown to make a difference in diseases associated with CKM. So from a lifestyle perspective, a lot of the same advice that you've probably received from cardiovascular disease prevention really holds true across CKM. So foods, really trying to limit the processed food, ensuring a diet that's adequate in fruits and vegetables. I'm sure that every time, if you're like me, you go to the doctor and they really grill you on your physical activity. I hope that people do a better job than me of this. And I think this is really important because I think these things are very, very noticeable. Even when I can tell when I'm exercising or not, and I'm checking my blood pressure, it is a noticeable difference from a physical activity. So following recommendations for things like 75 minutes of vigorous physical activity every week, 2.5 hours of moderate, those types of things still really, really important in CKM syndrome, as are things like quitting tobacco. And then I think sleep is another thing that is really our knowledge of just how it affects cardiovascular risk is developing as well. So ensuring that you're ideally getting between 7 and 9 hours of sleep a night. All of these are really effective and really paramount across the CKM syndrome. Pharmacologic standpoint or a medication standpoint, and this is where it gets more complex, and I certainly don't want to go over every word on this slide, but just to highlight some of the interventions and just to show you if there's one takeaway that you take from this slide is that there are medications that have proven benefits on the heart and the kidney. So again, highlighting this overlap of the syndrome and just how important it is to think holistically as opposed to think about one organ. So we've talked about blood pressure reduction quite a bit already from a glucose control and a diabetes perspective, ensuring that the glucose is controlled to prevent further organ damage, particularly with the kidney, is very important, as is knowing your cholesterol levels like LDL. So that covers the risk factor management. ACE inhibitors or ARBs, if you're on medicines that end in pril, like lisinopril, for example, or that end in artin, like losartan or valsartan. These are medicines that effectively treat blood pressure, and they also slow kidney progression. And so you can see here this class of medications has been associated with reduced cardiovascular events, but also reducing some of the bad kidney outcomes. One of the really great advancements, particularly over the last decade, has been the SGLT2 inhibitors. So these are medications that end in flozin. If you've heard of those or been on those type of medications before. And their backstory is really interesting, as are several of these medication classes. But effectively, these medications are really becoming foundational in CKM from a reducing cardiovascular mortality, hospitalization for heart failure. And again, you see benefits as well on kidney protection in terms of reducing that kidney disease progression. So this is just a highlight that we really have a collection of medications now that not only impact heart outcomes, but that also can impact kidney outcomes. And so really thinking holistically in medication choices is really important. And hopefully this slide informs on that. So I think there were some great questions about some of the challenges of current models of care in the introduction. And what might the future of CKM care look like? I can tell you the last year, probably, when we go to medical conferences, the concept of CKM and just how care is best provided is always a topic of discussion. And I mentioned earlier the formal guidelines that have come out this year. And I think hopefully we all see improvements in the way that really comprehensive CKM care is delivered. And I think what you're going to see is probably going to be dependent from health system or clinic to health system, because one model might not work for everyone. But some of the things that you may see what's called a CKM coordinator. So maybe a nurse practitioner, or a pharmacist who really helps navigate and coordinate the appointments and the lab testing between your various specialists. You may see like a nurse practitioner or a pharmacist who's met with several of your other doctors and really helps to coordinate and deliver your care in that. It's highly unlikely that you will go to an appointment and have, your endocrinologist, your nephrologist, your cardiologist, and your primary care doctor in the same room. As ideal as that may be, the logistics of that are very, very difficult. So some of those different care coordination for CKM hopefully you'll see in the future. You may have already seen CKM clinics, clinics that try to do some of these approaches. You may have seen those pop up in your healthcare already, but I think are almost certainly to increase in the future. So, how can patients best advocate? We talked about the complexity of this, seeing different doctors, and the disease complexity. And I think I would suggest maybe three things. One is to know your medicines, either yourself or your caregiver, to be able to say what medicines that you're on. And I think importantly, to be able to keep track of changes. So, for example, if one of your medications is stopped because your potassium level is too high or because your blood pressure is too low, for example, to be able to tell your next doctor that if they ask why you're off of a certain medication. The other one, and I think we talked about this in the quiz already, is know your numbers. And it looks like there's a great handle on cholesterol levels and blood pressure levels and even glucose, I think was the other one on there. I'd encourage the same thing with your kidney numbers, with your EGFR, as well as the UACR, to know what those numbers are and really importantly, how they're trending for you. So are they getting worse? Are they getting better? And I think those are very important things to have a handle on to be able to bring those conversations up with your different healthcare providers that you're seeing. And then the last thing, armed with hopefully what you've gained from this awareness of CKM, is when you're discussing new medications with your doctor, I would really encourage you to try and understand the benefits across all of your diseases. So if, for example, you're with a cardiologist and in the process of shared decision making, you and your doctor are trying to decide if a medication is right for you, try and ask, how does this medication help my heart, my kidneys, my diabetes? And I think that gives you a much better understanding of, do I want to add another medication to my regimen? I know I'm going to have to pay for this medication. I know I'm going to have to take another medication that may or may not have side effects with it. And I think it really lets you be empowered to help make those decisions, understanding the broadness of CKM and how these medications can help those different disease states and whether it's something that you want to stay on, understanding the benefits of those medications. The last slide that I'll show here, and again, there have been several organizations that have really leaned in and adopted CKM education, both towards patients and healthcare providers. American Heart Association has great materials about what CKM is, as well as checklists, particularly when we were discussing to know your levels. The links are here on this slide, or you can also Google American Heart Association CKM. Same thing for the National Kidney Foundation. Really great education on CKM, particularly from a kidney focus as well. So I can't recommend these resources as enough. And with that, I will go ahead and turn it back over to Jerome. Thank you.
Thank you, Dr. Flannery, for that very informative presentation. So understanding how the heart, kidneys, and metabolic systems work together is essential, and you've helped us better understand why early recognition, coordinating care, and patient engagement are so important. It's now my pleasure to introduce our patient guest, Corvin Morton. Corvin is joining us from the great state of Texas and is a new AAKP ambassador. Corvin's kidney journey began unexpectedly after 8 years of working in the aerospace industry, where prolonged stress and severe hypertension ultimately led to kidney failure. Throughout his journey, he has faced numerous challenges with determination, resilience, and a commitment to sharing his experiences so that others can learn from them. Today, Corvin joins us to discuss what it's like living with kidney disease and other comorbid conditions, and to share lessons he's learned that may help others facing similar challenges. Hi, Corvin. Welcome.
Good afternoon, everyone. My name is Corvin Morton. I'm 65 years old. I've been in the defense aerospace business for 42 and a half wonderful years. I am currently battling end-stage renal failure. I've had a successful transplant, and now new to me, and believe me, I'm not disappointed. I'm not depressed. I keep a smile on my face. I have heart disease. I'm battling the heart disease, put it this way, with a smile on my face, and I will win this war. One thing I would like to tell everybody, part of this air engagement battle of kidney disease and heart disease is the psychological and mental aspect of the fight. I will win fights. I win all fights. I correlate my kidney disease and heart disease to aerospace aspects where I can fully understand. I transfer those, typing up questions, doing my own research, and submitting them to my medical professionals, especially to my RNs. My nephrologists and cardiologists are swamped. They're outstanding people, but my RNs are my first line of engagements. I submit my questions through my chart and other medical websites. I read my own laboratory reports. I adjust my diet in accordance with the lab reports. And now, since cardiovascular disease is new to me, I'm doing the same thing. I am winning both battles at the same time through mental determination. And also, the psychological aspect is I win all engagement battles I am in. I just had a very successful cardioangiogram procedure day before yesterday, joking with the medical staff, letting them know I enjoyed my procedure in the hospital, and I found out some very positive news that came out better than I expected. Again, research, typing up your questions, and submitting them to the medical professionals to get their final opinion, whether if you're researching medications or any type of procedures you think that might want to help you, is helping me out 100%.
So, Corvin, can you talk about the lifestyle changes you've made that have made like the biggest difference in your care?
Yes, sir. One of the major lifestyle changes I've made during the winter time, I do not engage in enclosed gatherings in buildings because people are huddled up in buildings during the winter. People travel sick, people go to church sick, people go to parties sick. So I kind of isolate myself during the winter times deliberately. This is for a reason, and it's helped. I have limitations on the amount of exercises I perform. I do exercise, but no more Houston marathons or anything like that. I do get out in the hot temperatures, cut the grass. I do a lot of my physical engagements to a certain limitation. And one thing that has really, really helped me out tremendously is AAKP's website. I download the sub files in there, PDF those, print them out, and I base a lot of my questions off of AAKP's website to my RNs and to my nephrologist and now my cardiologist. But again, my days, just like when I was a teenager, of jumping off the roof of my parents' houses, those days are gone, and I know my limitations.
So, how do you stay motivated like during times when, sometimes managing your health can feel overwhelming? So, how do you stay motivated during those times?
One of the main things I do for motivation, and even though I found out I have heart disease, I told my cardiologist, just like my nephrologist, every fighter aircraft has to go into the hangar, which is the hospital or the clinic, for maintenance. Once you come out of the maintenance hangar, which is the hospital, normally you there are aspects, if you comply with the medical professionals' instructions, you normally come out a little bit better. But again, the psychological aspect of this, in my opinion, is half of the weight of fighting the battle. One thing I do want to say on the psychological aspect of managing now both heart disease and kidney disease is our normal day is always somebody else's dreams. Those who fail to plan, plan to fail. That's how I manage things.
And so, if you could leave our audience with one message today, what would you want them to remember?
In my opinion, the main thing I would like for all patients, as well as individuals who do not have kidney or heart disease, is it never hurts to do your own research. Get your physicals done, go to your clinical appointments, type up your questions, what you think that might work with you, and submit them to your RNs, and they will submit them to the appropriate medical professionals like your cardiologist and doctors. Be proactive towards your own fighter aircraft, which is your body, and your power plant, which is your heart. I am going to always be proactive towards my airframe and power plant because I'm the one that has to live with this. And even right now, as I'm speaking with you, despite the heart disease and the successful transplant, I sleep well at night. I am pain free. And this is the happiest I've ever been in my adult life.
Awesome, Corbin. Corbin, thank you for sharing your story with us today. Your journey is a powerful reminder that behind every diagnosis is a person, a family, a unique experience. We appreciate your honesty in sharing both the challenges you face and the hope you've found along the way. Now I'd like to invite both Dr. Flannery and Corbin back to join me for our live discussion. During registration, many of you in our audience submitted questions about CKM syndrome, kidney disease, and living with multiple chronic conditions for our speakers. We'll spend the next few minutes addressing some of those questions. First, Dr. Flannery, we've heard from Corbin, who described his experience navigating multiple conditions. From a clinical perspective, how can patients become active partners? I know you talked about this a little bit before in your presentations, but how can patients become active partners with their healthcare team to help manage CKM syndrome and improve long-term health outcomes?
No, thanks for the question, and I love Corbin's analogies and really sort of taking that proactive approach with questions. I talked about knowing your numbers a lot as well, and if you don't right now, that's totally fine. Not everyone does, and I don't think that you have to be able to pinpoint numbers. I think as long as you sort of have in your head of what the important things are for each system. So for chronic kidney disease, it's things like your EGFR and your UACR. And even if in your head you think about those as sort of green light, yellow light, red lights, and just to understand the trend or not. And I think it's whether it's a written question to your RN, whether it's during your appointment, hey, when was the last time that I had my UACR checked? Am I doing okay with that? I think those are great places to start from really a knowing your numbers standpoint. And then again, I'll just reiterate, when discussing medications, really asking, is this going to impact my heart, my kidney, my diabetes? Will it also help me lose weight? Just to give you yourself really the best understanding of what some of the medications can do these days.
My next question is for Corbin. What advice would you give someone who has just learned they may be at risk for another, diagnosis, condition similar to CKM syndrome? What advice would you give to that person?
First thing I would tell that person, it is definitely not the end of the world. That's a fact. I'm proving results of that. Second is be willing to talk to the medical professionals. They are super busy, but let the medical professionals know that you care about what's going on and ask them, what can I do to make your job as a medical professional much easier? Meaning, Be compliant to your lab reports. Be compliant to the medical professional's instructions. I found out listening to the medical professionals, then following it up by understanding your lab reports and knowing your numbers. I know my numbers for the heart disease and also on the kidney side. Example, 20 back in 2022 I had a 20% blockage of the heart. Yesterday, I found out I had a 22% blockage of the heart. That means I'm doing everything within my power to avoid a stroke. I know my GFR numbers, my BUN numbers, my glucose numbers, cholesterol numbers. If I have questions, I do research and I send those again to my first line defense, which is my RN. She's very responsive. I compliment her constantly. That's one of my biggest advice. Learn how to read your lab reports, ask questions to the medical professionals, and they will respond.
Thank you, Corbin. This next question is for Dr. Flannery. There have been significant advances in the treatment of chronic kidney disease and related cardiovascular conditions in recent years. What gives you hope about the future of care for people living with CKM syndrome?
No, it's a great question. And I think really a couple things. One is from a drug development standpoint, I think the recognition of CKM syndrome and the interconnectedness as drugs are developed, I think people are being much more intentional about looking at how new medications impact heart outcomes and metabolic outcomes and kidney outcomes. And when we know those things up front and study those things up front, it makes it much more effective in terms of getting those types of drugs available faster. Some of the other new things we talked about, just how foundational drugs like SGLT2 inhibitors or the flozins are to the various components of CKM. And I think in the future development, you're going to start to see combination products that have those combinations with things like SGLT2 inhibitors, which may decrease the amount of medications in terms of the number of pills that individuals may have to take. And then I think from a care perspective, just seeing the CKM syndrome really formally recognized and just the effort on behalf of the healthcare community to look at different ways of delivering care, that effort is real. And I think that effort is intentional. And again, I think it will look different from place to place, what that model looks like. But I think there's a very intentional effort to make a lot of strides in how we care for CKM.
Thank you. And one last question for Dr. Flannery before we let you go. If there's one message you'd like everyone watching today to remember about protecting their heart, kidney, and metabolic health, what would it be?
I think just how interconnected the heart, the kidney, and the metabolic diseases are. And I think the one takeaway is just because something is a risk factor, for example, just because hypertension is a risk factor, even if you develop the disease because of hypertension, hypertension is still a risk factor for further development of that disease and or new diseases. And I think just highlighting, again, how interconnected and complex these different components of CKM are.
Thank you both, Dr. Alex Flannery and Corbin Morton, for being with us today. We thank you for sharing your experiences and perspectives. If anyone watching has additional questions for our speakers or about today's webinar that we were unable to get to, please email us at info@aakp.org, noting the webinar title in the email subject line. If you are not already a member of AAKP, we encourage you to join. AAKP offers free membership to patients and their family members, as well as living kidney donors. To become a free member, join online at aakp.org/join or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As an AAKP member, you will be notified about all of AAKP's upcoming events, the latest in our educational program series, and when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the independent patient voice and change status quo kidney care. You will also receive a digital subscription to our bi-monthly magazine, AAKP Renal Life, and can select to receive any of our 5 different electronic newsletters, all for just signing up. We also invite you to check out our blog to read some great articles and patient profile stories, and follow us on social media for all the latest news and to keep up on what's trending. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their healthcare. We are proud to offer a variety of resources for both patients and care partners. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download free of charge, including titles such as The Pocket Guide to Managing Kidney Disease, Questions to Ask Your Healthcare Team, or The Kidney Beginnings, A Patient's Guide to Living with Reduced Kidney Function booklet. You can also order materials by phone. I'd like to invite everyone to join us at the 51st Annual AAKP National Patient Meeting taking place September 11th through the 13th at the Little Rock Marriott in Little Rock, Arkansas. The AAKP National Patient Meeting is one of the nation's premier educational events for people living with kidney disease, care partners, living donors, transplant recipients, and healthcare professionals. Attendees will have the opportunity to hear from leading experts, participate in interactive educational sessions, and learn about the latest advances in kidney care, and connect with others who share similar experiences. Best of all, registration is free for patients, care partners, and living donors, making it easier than ever to access trusted education, valuable resources, and a supportive community. We hope you'll join us in Little Rock for this exciting event. And if you can't join us in Little Rock, a virtual option is available. To learn more and register, please visit aakp.org. In addition to the National Patient Meeting, we invite you to participate in the AAKP Public Policy Forum taking place September 10th at the President Clinton Presidential Library and Museum in Little Rock. Participants will hear from nationally recognized experts, explore current legislative and regulatory issues, and learn how patient voices can help influence decisions that improve kidney health and patient outcomes. Whether you're new to advocacy or an experienced advocate, the Public Policy Forum offers unique opportunities to engage in conversations that can help drive meaningful change for the kidney community. We encourage you to extend your stay in Little Rock and join us for this important event as we continue working together to advance policies that put patients first. Finally, you can visit our special AAKP OnDemand webpage at bit.ly/AAKP OnDemand to watch a number of great presentations and webinars, all available on demand from our 2025 events and programs, as well as 2026 programs as they occur. You can also visit the AAKP YouTube channel at bit.ly/AAKP YouTube for more great content. AAKP thanks AstraZeneca for the sponsorship of today's program. We would also like to extend a heartfelt thank you to our webinar speakers, Dr. Alex Flannery, Paul Conway, and Corbin Morton, for graciously participating in today's HealthLine event. Their expertise and insights greatly enriched the discussion and provided valuable information. And thank you to everyone who joined us.